Welcome to this evening to our special edition speaker series, and we are celebrating Black History Month, and we are very, very excited to do so. We're very excited to have you here, and we just wanted to take a moment to say thank you for being here with us. And I do want to let you know that this is being recorded. So as I mentioned a few moments ago, we'd love to see your beautiful, beautiful faces. But if you choose not to be on camera because it's being recorded, that is absolutely fine too, not a problem. And excuse me, what we will do is we will, at the end of this, we will post this to our site. I believe Nina had already put in the chat the availability of our website, uniteforher.org/her library. And there you will find not only this, but you will find others as well. So if you have any questions about that, then that is absolutely, you can go there for the information. But we wanted to get started for this evening. And I wanted to just welcome everyone to this special edition speaker series, again, celebrating our Black History Month. We're very, very excited to present you with a panel of professional women of color in our community, and we look forward to receiving such wonderful information about health and wellness this evening. Also, our digital education series is brought to you by our 2022 educational sponsors. Thank you to our presenters, Merck, as well as our supporting sponsor, Exact Sciences. And as Nina was sharing that slide, we just want to make sure that we are recognizing them who is supporting us because it's very important for us to have that support. So a few housekeeping rules is, we were all chatting, but we're going to ask you to mute yourselves right now. We're going to start with the presentations, and then as the presentations go, if there is time for questions, then we will use questions, but you can always use your chat room. You can raise your hand, or you can unmute yourself or put a question in the chat, and Nina will help you with that. And a few reminders before we get started. Just want to tell you about some upcoming events that we have. So if you'd like to, you could join us tomorrow, February 24th at 1 p.m. on Facebook. And it's the Ask the Experts Healthy Beauty at Any Age. And this is with our Jolene Hart, who is our beauty advisor with Unite for Her. And she will be answering the top 10 questions on healthy beauty for young girls and women. And this is a topic that our women may want to share with their daughters or any loved one, because, it's again, talking about the clean type of makeup, clean type of things that you can use in your everyday routine. Also on March 2nd at 5 p.m. on Zoom, we're going to have a Unite for Her virtual hangout. And our provider is going to be Priscilla Fitzpatrick, and she is the owner and trainer of Stronger Through Cancer, which is an online resource that features live classes in strength training, yoga, and mindfulness. And if you are still on the program and have your passport, if you would like to use that service, 3 Squares provides you a 6-month virtual membership with Stronger Through Cancer. So that's going to be on March 2nd. And lastly, on March 3rd is going to be our next speaker series, which similar to what we're on tonight. And that again is going to be on Zoom. This speaker series will feature a program from Revital Rehab on combating cancer, related cognitive decline, or chemo brain. And we all heard of that. This is a topic that our community often asks about, and specifically how to manage or improve the cognitive decline that often comes from chemotherapy. So those are our upcoming events, and we just wanted to be able to share that with you. And we are going to get started with our program for this evening. So first, I'm going to ask Nina to, if she could spotlight Christy Jenkins. And as she does that, spotlighting Christy, I'm just going to read a little bit about Christy. So Christy Jenkins is the CEO of the Art of Paradise, where the art stands for authentic, raw talent. She is a poet, mentor, and a motivational speaker. In the poetry community, she is known as Paradise, and she enjoys music and dancing. She has been writing and reciting poetry for over 2 decades, and it's through this relationship that she has established with God that she has developed a better understanding of her gifts. Most importantly, that her gift is not just for her, but to inspire, uplift, and motivate others. Poetry is indeed therapy. It is their life purpose to reach, teach, help, and entertain others, to speak life into the lifeless situations, to be an advocate and a voice for the voiceless, and plant seeds of faith and hope for the hopeless. Christy was one of our wellness participants on our program and has been a mentor and ambassador to other women on our program. So with that, I'd like to introduce to you, Christy Jenkins.
Good evening, everyone. Thanks for having me. I think I'll dive directly into my poem, if that's okay.
That's fine.
This particular poem is called When Women Speak, and I love to do it for Unite for Her because this epitomizes what we go through and what we stand for. So, when women speak. When women speak, Mother Earth awakes, spirits are cast out, mountains begin to move, angels receive their wings, butterflies are called from their cocoon, generational curses are broken, demons tremble when women speak. Sisters soldier up, daughters fight to stand up, queens receive their crowns, jewels are polished, glass ceilings are broken, although her voice may shake as she awakes Lady Liberty, never mistake what she has to say. Despite being constantly interrupted, volcanoes erupt at the elevation of her octave. Though she be small, she be fierce, she be virtuous, she be queen, she be woman, speaking clearly, concisely. When women speak, fools shut up. When women speak, shh, listen without interrupting. There's much to learn. For centuries, our voices have been silenced, but we're here speaking up. Can you hear us? Beyond the noise, beyond the confusion, beyond the mansplaining, can you hear us? We ain't asking, just checking if you're listening when women speak.
That was awesome. Oh, thank you so much, Christy. And Nina had texted me and a text on the side. She says, I get chills every time I hear that. And that is the truth. You are so passionate and so expressive with that. And we just thank you for starting us off for that. Again, I'm going to drop in the chat right now. If you'd like to hear more of what Christy does, I just put in the chat her website. And again, it's www.theartofparadise.com, where she has more poetry there. She has some poetry sessions, and we like to support, our own. We are, as we said earlier on this call, we are a club of our own, and we like to support our own. So again, Christy, thank you so very much for being with us this evening.
Thank you for having me. I appreciate it.
You are welcome. You are welcome. Next, we are going to have a very special guest for us. Her name is Dr. Kristen Whitaker. And Nina, if you can spotlight her. So Dr. Whitaker is an assistant professor at Fox Chase Cancer Center in the departments of clinical genetics and hematology and oncology. Dr. Whitaker's practice focused on patients with breast cancer and patients at high risk for breast cancer and ovarian cancer. Her research interest includes cancer health disparities, cancer screenings for high-risk women, hereditary breast cancer, and improved clinical trial enrollment for minority patients with cancer. She received her undergraduate degree at the University of Pennsylvania and MD from Drexel University College of Medicine. She completed a fellowship in hematology oncology at the University of Chicago Medical Center before joining Fox Chase. So join me in welcoming Dr. Kristen Whitaker. There we go. Thank you, Dr. Whitaker, for being with us this evening.
Okay, very good. Can you hear me okay, Melissa?
Yes, we can. Thank you.
Okay, perfect. I'm going to go ahead and share my screen and then we'll get started.
Wonderful. And are you having problems sharing the screen?
No, I think I'm going to get it. I always just stumble through it a little bit in the beginning.
That's okay. There we go. I can see it now. Wonderful.
Okay, great. All right, let me just get back to the beginning. All right, so everyone can see my slides and hear me okay?
Yes.
Very good. So good evening, everyone. I'm really honored to be here tonight with you guys. And, there's a whole lot that I can say about breast cancer genetics, but I'm going to try to keep this short and sweet, but I hope that it will provide you with some important updates about kind of how far we've come with breast cancer genetics over the last 20, 25 years, okay? And again, I'm Dr. Whittaker. I'm a breast medical oncologist, primarily at Fox Chase Cancer Center. So briefly, to just review what we'll talk about, very briefly, I'll go over just some basics of inherited breast cancer. I'll discuss some changes that we've seen over the last about 10 years related to how we do genetic testing. And then I'll give you a brief overview of our current understanding of what genes actually can increase one's risk of breast cancer. And then I'll describe, and I actually think this is the most important part of the talk, especially for women who have breast cancer, is how we actually use some of this genetic information to help better manage your breast cancer. So when we think about breast cancer, the most common question I probably get from patients is, why did I get this? And a lot of times patients will say to me, well, do you think it's something genetic? And, what I'll respond to them is that typically we know that there are certain features of breast cancer or one's personal or family history of cancer that makes us more suspicious of a gene mutation. But in reality, most women that develop breast cancer are not going to do it in the setting of having a hereditary cause for breast cancer. So really having a gene that's being passed down through the family. But we do think that up to about 10% of breast cancers can be caused by genes passed through the family. I know we also may have women that have ovarian cancer in the audience. So I'll just point out too, when we think about ovarian cancer, we think this number is even higher. About 20% of ovarian cancers could be caused by gene mutations. And when we think of gene mutations, I think the first genes that oftentimes come to one's mind when you're thinking of kind of cancer-causing genes are what we commonly refer to as the BRCA1 and BRCA2 genes. I think that's partially because these genes were first identified back in the 1990s. So we've had some time to really learn about them and really understand the cancer risks that come along with these genes. So we first started testing for BRCA1 and 2 back in 1996. And now this is a very commonly done procedure. Women oftentimes will ask, well, how common are BRCA1 and 2 mutations? To which I'll respond, about 1 in 400 women will be identified to have a BRCA1 or a BRCA2 mutation. But I highlight here, and I think it's something that, a lot of times patients are surprised about. There are certain ethnic groups where we know the prevalence of BRCA mutations are much higher. So specifically in Ashkenazi Jewish individuals, we know that their prevalence is about 1 in 40 women. So much, much more common in certain ethnic groups. And then I always point out too, that when we think about any genes, but especially genes like BRCA, you can get a BRCA gene mutation from your mother or your father. So really we care about family history of cancer on both sides of the individual's family. And I'll talk to you about this a little bit. I'm highlighting here BRCA, but as you'll see as I go along with this talk, as time has gone on, we know that BRCA is really just the beginning of the story when we think about breast cancer genetics. So I always put this picture in my talk because, again, when I talk to people and I say, well, what do you kind of understand about genetics and kind of hereditary cancer? The first gene that people always mention to me are the BRCA1 and the BRCA2 genes. And I think that's partially because these genes, one, were some of the first cancer risk genes identified, but two, the BRCA genes have gotten quite a bit of media attention in various forms over the years. I think one of the people who probably raised awareness about the BRCA gene more than anyone was really Angelina Jolie, who's a popular actress. Back in 2013, Angelina Jolie very publicly talked about her experience of undergoing genetic testing, having a BRCA1 mutation identified, and then talked again very publicly about the steps she took to minimize her risk of developing cancer related to this BRCA gene, specifically having both of her breasts removed prophylactically to try to prevent cancer, what we commonly call a double mastectomy, and having her ovaries and fallopian tubes taken out to reduce the risk of ovarian cancer. So, you know, they coined this term called the Angelina Effect to really describe the fact that her coming out publicly with her BRCA mutation and her follow-up care really did cause a huge shift in terms of the rates of genetic testing that we saw, and also a lot more patients undergoing these preventative surgeries to try to reduce their risk of developing a cancer. So I think when we think about the BRCA genes, I do think that, you know, if someone has heard of the BRCA genes, most people are pretty familiar with the fact that the BRCA genes can increase one's risk of breast cancer. And if we look at these figures here, it's a very significant increase of your lifetime risk of breast cancer if you have a BRCA gene. So we normally, you know, quote that about 10 to 12% of women will develop breast cancer over their lifetime. So among cancers, breast cancer is a common cancer. So about 12% of women can develop it. But if you look here at these figures, you see that women, for example, with the BRCA1 mutation can have up to 87% lifetime risk of developing breast cancer. And not so different with BRCA2, we say this risk is probably closer to about 60 or 70%. The other cancer risk, though, I think sometimes, you know, patients know about, sometimes they don't. So I think ovarian cancer, oftentimes, you know, people know that ovarian cancer can be associated with BRCA mutations. I think the cancers that people are a little more surprised to know can also be associated with BRCA mutations are really things like prostate cancer. We especially think about having an elevated risk of prostate cancer when you have BRCA2 mutations. Male breast cancer is also something that we think about more strongly when you have BRCA mutations, although still very rare. And I can never find a good figure that incorporates this in here, but it's actually a really important risk to know about. We now also know that BRCA mutations can increase your risk for pancreatic cancer. So as you see, it's not just one cancer risk that comes from these genes. It's really a host of genes, and that's why we consider these hereditary cancer syndromes when you have a BRCA gene identified. So just a little bit about breast cancer and BRCA carriers. The biggest things that we see in terms of men or women who develop these cancers are that typically if you develop a breast cancer in the setting of having a BRCA mutation, we will see women diagnosed at a younger age with breast cancer. We also know that unfortunately, if you have a BRCA mutation, that you have a higher chance of developing a second breast cancer than someone who does not have a BRCA gene mutation. And over time, we've learned that there's some differences between BRCA1 and BRCA2 in terms of the types of breast cancers you develop. So, you know, BRCA1 mutation carriers are much more likely to unfortunately develop that most aggressive type of breast cancer, which we call the triple negative breast cancer. Whereas BRCA2 mutation carriers develop our more common breast cancer called estrogen receptor positive HER2 negative breast cancer. So this is something that I really highlight, and you know, I want to make sure we kind of have this as a take-home point, is that really since about 2010, we started to see some significant changes in terms of kind of how we approach genetic testing for cancer. So, you know, I think the biggest change is that we really have improved our technology related to how we can test genes for mutations. As a consequence, we've seen this big shift where in the past, if you were to undergo genetic testing, we would test for a single gene. So you would come in and we would think you had an increased risk for some type of cancer, and we would send a test just to look at the BRCA genes. But over time, our technology has improved. So now we can actually look at multiple genes at once, very quickly and very cost effectively. So the big shift is from what we call kind of single site testing, where we're testing just one gene, to now what we consider multi-gene panel testing, which again, really just means that we're looking at multiple cancer genes at once. And I emphasize this, especially for, you know, women that have maybe had initial breast cancer diagnosed, you know, before 2013 and had genetic testing. Because if you had genetic testing before 2013, the chances are that you only had testing for the BRCA mutations. That was the most common practice then. But since 2013, we've identified a host more of breast cancer genes, and we do multi-gene panel testing. So I say that to say, if you had genetic testing before 2013, or if you recall specifically that you had genetic testing that only included BRCA mutations, it's probably a good idea to talk to your doctor or talk to a genetic counselor about potentially doing a multi-gene panel test to see if there's some other type of breast cancer gene that hadn't yet been identified in you. So that's just kind of, I think, an important take home. When we think about multi-gene panel testing too, we know not every patient is going to have a BRCA mutation, but we know when we do these multi-gene panels that we increase the chance by about 50% of identifying some type of cancer-causing mutation as compared to just doing BRCA only testing. So I put this here, and I find that, again, I think what a lot of patients are most shocked about related to kind of genetic testing for cancer is that most of the genes that we identify that increase risk of cancer don't increase your risk for just one type of cancer. So a lot of times when we'll come in and say, I have breast cancer, and my mom had breast cancer, my sister had breast cancer, so I want to do testing for a breast cancer gene. But the reality is there are few genes that only increase your risk for breast cancer. Most of these genes also increase your risk for other types of cancers. So I won't, go in great detail, but I just want to tell you that, looking at this chart here, this really just summarizes all of the genes that we currently think can increase your risk of breast cancer. So you can see here, BRCA1 and BRCA2 are here, but there's actually quite a few of other genes that we know increase your risk of breast cancer, such as ATM, CHEK2, PALB2. But I point out that, these genes don't only increase your risk for breast cancer. So for example, for PALB2, we know, again, you can have this elevated risk of breast cancer that can be as high as 60%. But we also know that you have an increased risk of ovarian cancer. We also know you have an increased risk of pancreatic cancer. And, you'll have these slides, I think, to look at. But, just pointing out that with all of these different genes, there really are other cancer risks that come along with it. So it's important to kind of know that. And that becomes important in terms of screening also. And then, the one other kind of, I think, interesting finding, this is a newer update, this is why I put this asterisk here, is, these genes right here, BART1, RAD51C, RAD51D, for quite some time, we weren't quite sure what cancer risk came with these genes. For these RAD51 genes, we actually thought the only risk that we really got with them was an ovarian cancer risk. But as we've continued to study these genes, we actually are seeing now that these genes also have a breast cancer risk. And in most cases, again, they have the risk of that most aggressive subtype of breast cancer called triple negative breast cancer. So, all just pointing to why it's important to think about genetic testing when it's appropriate, which I'll kind of go over kind of when we think you really should be doing genetic testing. So this is a slide where, I think it's really important. I'll start with for, women who have a breast cancer diagnosis, when we absolutely recommend you have genetic testing. What I always will say is that kind of insurance coverage varies for genetic testing, but most times when you meet this criteria here, then we can make a pretty good case to tell insurance they need to pay for your genetic testing. So some things to think about if you yourself have a diagnosis of breast cancer, when you absolutely should be having genetic testing. So first, if you were diagnosed at a young age, so young in terms of genetic testing, it's age under 45. Some insurances will also consider age up to 50, but it really depends on your insurance. If you have male breast cancer is exceedingly rare. So if you get diagnosed with male breast cancer, you should have genetic testing. Another group that I think is really important to point out is if you have that most aggressive form of breast cancer called the triple negative breast cancer. Remember, we just talked about genes like the BRCA1 gene is very commonly seen in triple negative breast cancer, but there are a list of other genes that are common for triple negative breast cancer too. And I'll point out this again because just until this year's update to kind of some of our guidelines for genetic testing, the cutoff age for when we said you should have genetic testing with triple negative breast cancer was if you were under the age of 60. This now has been expanded out to any age of triple negative breast cancer. So for example, if you got diagnosed with breast cancer 2 or 3 years ago and you were 62 at the time, likely you weren't referred for genetic testing, or if you were, insurance wouldn't have paid for it. It's probably a good idea to go back and talk to your doctors and say, hey, I have triple negative breast cancer, but I never had genetic testing. Can you help me set that up, kind of thing? And then there are a couple of other, kind of factors in patients with breast cancer that we look at too. Remember, we talked about in one of the beginning slides that individuals that have Ashkenazi Jewish ancestry have a much higher rate of Brca mutations. So any patient with this Jewish ancestry plus breast cancer is recommended to have testing. And then again, because one of those earlier slides where I showed you, we have really this syndrome where we know that breast cancer, prostate cancer, pancreatic cancer, ovarian cancer, they all can be connected through the BRCA gene and some other genes. If you have breast cancer yourself, but then you also have family members that have something like pancreatic cancer or ovarian cancer or male breast cancer, that's an indication that you really should be having genetic testing. And then you'll see in kind of the final slides that we also now recommend any patient that has metastatic breast cancer, so that's breast cancer that's spread outside of the breast, to undergo genetic testing because it can have implications for your treatment. And then also some of our higher risk early stage breast cancers are also recommended to have genetic testing. I won't go over this in a whole lot of detail, but just in case there are family members that are listening too, even without a history of breast cancer yourself, if you have close family members that meet some of these criteria, so specifically a close family member that had ovarian cancer or breast cancer or pancreatic cancer, advanced stage prostate cancer, we recommend you have genetic testing. I won't go over this in great detail, but sometimes patients do ask, well, what happens at a genetic counseling visit? This just summarizes it. Basically, you meet with the genetic counselor. She goes over the details of your personal medical history, but also your family history related to genetic testing. And then she goes over risk and benefits of genetic testing. And then it's a very simple procedure. It's normally a blood or a saliva sample to get the tests completed. And results can take about 4 weeks to come back. I think I'll skip this slide just in the interest of time. But I do think, especially because we have many women who have breast cancer in our audience, it's important to just highlight why is it important that we identify these Bracha mutations, okay? For you as an individual, I mean, I could give you a whole talk on how it's important to recognize these genes for your family members because it can really be important for cancer prevention in them. But we now know as time has gone on, it has really important implications for you even after a cancer diagnosis. So for starters, when you look for a gene mutation, identifying a cancer-causing gene such as BRCA can be very helpful in helping women determine what's the best type of surgery to have. So for example, if you had a BRCA mutation identified before you went to surgery, then that can really help a woman make a decision. Should I only have a surgery on the breast where I have cancer, or do I want to do something to prevent a breast cancer on the opposite breast? Because like we said, you have a much higher chance of developing a second breast cancer. For women who have cancer and they elect not to do double mastectomies, it also can change the type of breast cancer screening you're recommended after diagnosis. Mm-hmm. So most women are going to have a mammogram once a year, but BRCA mutation carriers also have a breast MRI. And really what I think is the most exciting and really the newest findings related to kind of how we apply this genetic information to breast cancer patients is it actually can change what treatments you're eligible for as a breast cancer patient. So I'll talk to you very quickly about it in the interest of time, but there are several studies that have looked at this new class of medicines called Parp Inhibitors, which can be used in patients that have high risk early stage breast cancer, but also in patients that have that stage 4 or metastatic breast cancer. So just to tell you very briefly, Parp inhibitors are approved for women with BRCA1 or BRCA2 mutations. Essentially, the first approvals for these drugs came in the setting of metastatic breast cancer back in 2018. I will just tell you that, again, we have these same kind of drug approvals for patients with ovarian cancer, pancreatic cancer, and prostate cancer. And there were several studies that helped us kind of figure out these genes. So just in the interest of time, I'll go through them very quickly, but this study here called Olympia D essentially showed that in patients who had metastatic breast cancer, if you gave them this PARP inhibitor and they had a BRCA mutation, it actually doubled the amount of time that their cancer was controlled and did not grow compared to kind of standard chemotherapy. So that's one study. I'll skip the side effects in the interest of time. The second study here was a study called Imbraca. So it looked at a different PARP inhibitor, but showed very similar things, that it increased the amount of time that cancer was controlled compared to standard chemotherapy in women who had BRCA mutations. And then this is the newest finding. This data is not even a year old in terms of being published. But those first two studies I showed you about were really for women who had metastatic or that stage 4 breast cancer. This is for women who have early stage breast cancer. So breast cancer that's still localized to the breast, but it's high risk for certain features. Either they went through chemotherapy and they didn't have a complete response before going to surgery, or they had positive lymph nodes, they had large tumors. But it basically put women into two groups. One group, they got 1 year of olaparib after they finished their chemo and the surgery. The other group, they got a placebo. And again, we see improved breast cancer outcomes. We see the amount of time that women live essentially without breast cancer recurring is higher in the group of women who got olaparib. And we see that women who got olaparib, which again is that PARP inhibitor that's targeting the BRCA mutations, they also had fewer deaths. So this has been a really exciting finding for us just in this last year. We're just kind of starting to roll this out in our patients. Honestly, as far as FDA approval, because the publication is still kind of pending, we don't even have FDA approval for this, but we have started to use it in some of our high-risk patients. And I just will put this out here for anyone who's in Philadelphia or kind of surrounding regions. Fox Chase really has a very amazing program we call our risk assessment program. There are only a handful of institutions that have these programs where you can get kind of comprehensive kind of genetic care. So that comes, starts with genetic counseling and testing. If you have a gene mutation identified, you then can kind of have all your screening done in a clinic that manages women who are high risk. And it's important to point out that many women that come to this clinic are women who don't yet have breast cancer, but they have genetic mutations identified, or they have family members with breast cancer. So it's a really important thing for you to know about your family members as well. And that's everything I wanted to tell you. It's a lot of information, and I'm sorry I took a little long, but I hope that it was useful for you all.
Thank you so much, Dr. Whittaker. And, yes, it was fine with the timing because this information is so important. We hear so much about genetic testing at this point and, what you should look for and things like that. So I think that you gave a very good overview, a very great understanding. And something that I took away with is, like you said, with that most recent study, it can show you different forms of treatment for, better treatments. And that's so important. So we appreciate your information that you shared tonight. I think there were a few questions or comments in the chat, but I really think that you explained them. One was talking about the insurance, and you went over that about, how sometimes, the insurance may not, but if you position it in a way, and those are the guidelines that maybe the insurance will cover, that was good to know, because they did say that ultimately that the insurance did take care of it, but it was a little not risky, but a little tough at first to get it taken care of. Mm-hmm. And then you talked about the, HER2 as well with the BRCA gene. So very good information. I don't see any questions right now. If there are any questions and anyone who wants to come up and chat just to say any final words to Dr. Whittaker, you're more than welcome to.
And I see a couple of other little things on here that I think I'll just respond to in the chat for the interest of time, okay?
Absolutely. Well, thank you. Thank you again. And again, if Dr. Whittaker is going to be on, if you want to communicate with her in the chat room, you are more than welcome to do so. And then we are going to just continue on with our program. And I should have said this at first, we are here today, and this speaker series brought to you by our wellness team. So you have myself, Melissa Christy, as one of the wellness program managers. And then we also have Nina Retrovato. She is my partner in crime, and she is another wellness manager here at Unite for Her. So at this time, I'm going to ask Nina if she would like to introduce our next speaker, which is Rae Whatley.
I would love to. So Rae, I'm going to find you and spotlight you. There you go. I'm going to read your bio, but I also just would like to share with everybody, again, if you're a current passport holder, Rae is one of our Reiki practitioners. She is amazing, amazing. We always feel so fortunate to be able to have her join us for our wellness days and to get to listen to her speak and talk about Reiki, which I think is so special. So Rae has been a Reiki practitioner, wellness consultant, and teacher for over 20 years. She's a native of Philadelphia, but lived and worked on 5 continents before starting her family, which I read this today and I was like, 5 continents, that's amazing. She is certified in massage therapy, pregnancy massage, Reiki, therapeutic touch, and zero balancing. Most recently, she has renewed her studies with Tadao Yamaguchi of the Jikiden Reiki Institute in Kyoto, Japan. That was really testing me. In addition to practicing and teaching Reiki, she also coaches people on safe and effective strategies for making their homes into healthier spaces. When she's not working, walking a dog, or looking after her family, Rae loves to escape into the woods where she sleeps in trees. Take it away, Rae.
Well, that's me. That sums it up. So now I don't have to talk about me. I can just talk about Reiki. Fantastic. I'm so delighted to be here with all of you this evening to talk about one of my favorite things, which is Reiki. And as you heard in the introduction, I'm currently studying with a Japanese teacher whose mother did Reiki. She learned Reiki in the 1930s and did Reiki practically every day of her life. My grandson has just come into the room. Sweetie, I'm working, okay? So I'll be after. All right. Sorry about
That's
that.
called real life, Rae.
No, that's called, yeah. So Reiki is a Japanese energy healing treatment. It is almost 100 years old, and having the privilege to have lived in Japan and also now study with a Japanese teacher has really allowed me to understand the cultural level of Reiki. So as an energy treatment, usually people think maybe it's, like a woo-woo thing, maybe it only works on a certain level. Reiki was originally designed as an effective treatment for the improvement of mind, body, and spirit. And I have found over the 20 years that I've been using Reiki that it really has so many positive implications for daily life. I have used Reiki with my family, friends, coworkers, and of course, all of the people that I've used Reiki on professionally. Even though Reiki has been around for a long time, there are still a lot of people who have not heard of Reiki or might have a different understanding of what Reiki is. As an energy treatment, Reiki can be done in person or over long distances, so it is not constrained by time or space. The energy of Reiki has often been defined as universal life force energy. What that means is Reiki uses the energy that exists all around us. It's in every living thing. So it's not something foreign. It's not something that can hurt you. It's perfectly natural and unbelievably super effective. Some of the things that Reiki, well, before I go into what it can be used for, I want to give you a better understanding of how Reiki works in the body. On the different levels, mind, body, and spirit, Reiki has been found to be effective for soothing anxiety, depression, helping you sleep better, helping digestion. It's very effective at relieving pain. It's very effective at supporting your body's immune system and your body's detoxification system. Reiki can be used on anyone at any time. There are no contraindications, does not have negative interactions with any medication. So whatever kind of treatment you might be going through, Reiki can help. As I mentioned, Reiki supports the body's systems. So for example, with detoxification, once you have you're going to go in chemotherapy or you've had surgery, and so you're on a number of different drugs, those drugs go into your body, they do the job they're designed to do, and then they just kind of sit around. Reiki is wonderful for supporting your detoxification organs, your kidneys, your liver, your digestive system, to move those chemicals out of your body once they are no longer needed. The way I like to think of this is if you have a beautiful babbling brook and you look at it and the water is so clean and so pure and you think, gosh, you know, that's fantastic. But if you stick your hand in the water and you swish it around, all of that silt, the sand from the bottom comes up into the water and it makes it a little murky and you see it get washed downstream. The thing that Reiki does is it swishes up the sand in the bottom. It helps your body to pull out those chemicals that are just resting in your fat tissue and your bone tissue that aren't doing you any good. So we move those around to get them up into your blood system, into your lymph system, so that your body can eliminate them. That elimination process helps you to feel better, less nauseous, you have more energy, you feel more like yourself. Physically, aside from the detoxification, Reiki can help you feel less pain. What that means is you have a better quality of life, you sleep better, day to day you feel better, but also you need less pain medication. So that's one less thing that you have to worry about is this, you have this alternative for helping you feel better every day. Reiki also, in supporting your body's systems, helps your body heal better. So once we've helped to detox, relieve some of your pain and inflammation, now your body can focus on doing the things that it's designed to do, which is help you heal, feel better, be better. So we're talking about this energy. How do you get this energy? What does a Reiki session look like? Because of time constraints and also the space that I'm in, I'm not able to give you a live demonstration, but I will describe to you what it looks like. If you've ever had a massage, you're familiar with the massage table. A lot of people, when they think of Reiki or when they hear of Reiki, they think of it as something that goes along with massage, and it often does. I did Reiki on numerous people in the course of my massage career. Just you have your hands on people and that energy just flows. In a Reiki session, you are lying on a massage table, but you are fully clothed. There is no pressure and there's no manipulation. So it's very gentle. And this is so important if you have tender spots. Again, if you're undergoing radiation or if you've recently had surgery, you don't have to worry, well, maybe I can't have this treatment because there'll be pressure or touch. Reiki is effective with very gentle touch or even with the hands slightly above the body without touching. And again, Reiki is also possible and effective as a long distance treatment. So while you're lying on that Reiki table, the Reiki therapist will usually start at your head. They'll place their hands gently on the top of your head, and you will probably feel heat. This is what most people report is the most common sensation. Some people feel energy moving. Some people feel a buzzing sensation. Some people have even reported feeling a cool sensation. It's different for everyone. There are some people who don't feel any specific sensations at all, and that's okay. Reiki is always working. So we start at the top on your head and then move through a series of hand positions from your head to your feet. Oftentimes, we might spend extra time on areas of specific concern. So if you've just had a mastectomy, I'm going to spend more time over that area. And that's to, again, support your body, help with the healing, help with the pain. You can lie on the table on your, usually we'll start you on your back and turn you to your stomach. But the positions that we go through can be applied whether you are on your back, on your stomach, or even sitting up. So I never want someone who's recently had treatment or recently had surgery to feel like they can't go for a Reiki session because you can't lie on your stomach, for example. That's okay. We can still work on you. We can work on you in a chair. We can work on you in a recliner. And when I'm doing long distance Reiki treatments, I always tell the people, sit so that you're comfortable. If you're comfortable on your bed, fantastic. If you're comfortable on a sofa, if you're in a recliner, just make sure that you're comfortable. That's the number one priority. We can work on you in whatever position you're in. Again, either a very gentle touch or hovering just above your body, going through those positions, working on those areas most troublesome. Also spending time over your detoxification organs, your kidneys, your liver, some time over your digestive issues, really wanting to focus in on what's happening with you that particular day. If you're not sleeping, you might spend extra time on your head. If you are having trouble with your digestion, if you're super nauseous, we're going to spend time on your digestive system and your detoxification organs. There is no, like I said, there are no contraindications. Reiki is wonderful and supportive. You will feel perhaps different over the next day or two. So when I'm working on someone, I also always like to tell them, even though I'm working on your head or on your chest, the energy is going to go to the place in your body that most needs it in that moment. So if you are having treatment on your left chest area, you might also be having some issues in your lower back on the right side. The body does what it can to balance. And so sometimes things show up in other parts of the body that you would think are not related, but that are. So it's so important to talk with your therapist, talk with the person who's doing Reiki. And this goes for massage, acupuncture, anything that you have going on. It's not just the area that you think needs treatment. We want to know about your entire body. Are you not sleeping? Are you not eating? If you've had headaches, these are all things we want to know. During the treatment, if you feel cold, if you feel hot, if you have questions, it's always okay to speak up. I want to talk a little bit about different kinds of treatment and how Reiki can support you. So I mentioned chemotherapy. Reiki is wonderful for raising your internal core body temperature. This is also great for people who are trying to get pregnant. Helping you with nausea, helping you with pain, helping you with headaches, helping you sleep better, helping you have more energy. When you have a Reiki session, that energy continues to work in your body over the next 24 to 48 hours. So you might feel a difference going forward. That night you might sleep better than you had the night before. The subsequent night you might find that you sleep even better. If you're having radiation, because there is no direct pressure, remember, there doesn't have to be actual physical contact. Reiki is wonderful for helping to relieve the pain, that burning sensation, helping with inflammation, helping, again, detoxification, making you more comfortable in your body. If you are going to be undergoing treatment, I hope you can't hear my marauding grandchildren downstairs. If you're going to undergo surgery, Reiki can support you before and after. One of the fantastic things that Reiki does is help with anxiety. Now, there's no way you can go into a major surgery without having some amount of anxiety. I like to say that Reiki helps that little hamster that's on the running wheel, that constantly your mind is constantly going and you can't stop thinking, what do I need to do? Have I done all the things that I could do? What do I have to do next? It's constant. One of the things that 99% of the people I work on tell me is, my mind just shut down. Everything stopped. Everything was quiet. It was fantastic. So I like to say that during a Reiki session, we get that little hamster to go out for a cup of green tea. So it's giving you a break. It's giving you time just to be in your body without worrying. By relieving your anxiety, we're going to lower your blood pressure. We're going to get your body in a really good space to undergo that surgery. After surgery, we're going to help your body to flush out the pain medication, the anesthesia, all of the other drugs that they put in during the course of the surgery, right, to help things keep you where you're supposed to be. Again, we're going to help decrease your pain level, which will mean less pain medication. We're going to support your body to do the healing it needs to do. So you will bounce back from surgery a little bit faster. You will start to feel like yourself a little bit sooner. Reiki is great at supporting you, like I said, no matter what treatment you're undergoing. It's perfectly safe. It's comfortable. There are no contraindications. There should be no discomfort during a Reiki session. If for some reason you are feeling some discomfort, you need to tell your therapist right away. It could be related to the position that you're in. It could be your body just adjusting. If you feel something that's not comfortable for you and it lasts longer than a moment or two, then that's something that, you know, you should be discussing. I want to take some time for questions. Before I do that, let me also talk for just a little bit about what a distance Reiki treatment looks like. As I said before, I ask you to get comfortable in your own surroundings. You can play music or not, whatever music feeds your soul. So if that's rock, if that's jazz, if it's blues, if it's classical, right? It doesn't have to be meditation music. It should be the thing that feeds your soul. I check in with the person before we start our session, see where you are that day, what areas I need to focus on, and find out if you have any questions. Then it's not done over the phone or on the internet. We talk beforehand, we get off the phone, I give you a few minutes to get comfortable, and then we start the session. If you're wondering, you know, does this really work? Am I going to feel anything? Most people that I do distant treatments on are able to tell me, I think you were on my head in this time, and then you went, you know, to my chest, and I felt you, you know, I felt something in my stomach. Is that where you were? Or I thought I felt you, you know, on my feet. And most of the time they're spot on. So, you know, probability is high that you will feel something during your Reiki session, even during a distant treatment. After we're done, I give you time to come back to your body, get some water, run to the restroom, and then we chat on the phone to answer any questions, to talk about how you were feeling during the session, and really anything that you need to discuss. Reiki is not a religion, although it is a spiritual practice. Because it's not a religion, it doesn't go against any religious beliefs that you might have. When we talk about this universal life force, sometimes people interpret it as spirit, but we're not talking about random spirits that are flying around that are waiting to, I don't know what word to use besides possess. I've actually had people call me and ask if I could, you know, tell if someone was putting a spell on them and things like that. That has nothing to do with Reiki. Again, it's a healing energy treatment. It is completely benevolent. It is completely safe. So are there any questions?
Rae, thank you so much. You have a lot of great feedback in the chat. I don't know if you can see it. Some Reiki practitioners are on with us as well. I think that you answered this, but Martha asked, if you're not sleeping because of steroids, how does Reiki help that? And I think you did address that Reiki can definitely help with sleep. I don't know if you wanted to expand on that at all.
I don't want to make any specific claims because everyone's different. You know, I don't know how long you've been on those steroids. My mom was, that family members on steroids for various things. everyone's different, right? And so what you might experience from having one Reiki session also would be vastly different from if you had a series of Reiki sessions, right? So if we started to detox you in the first session, 6 sessions later, or 4 sessions later, your body might be in a completely different place. And so the way that you would retain or metabolize your medications might be different. But even people who, I think of them as type A personalities, they're constantly going, they're constantly talking. Those people who say, I never lay down for more than 20 minutes, I can't sleep more than 3 hours a night, fall asleep during a Reiki session, sleep longer at night. And, that's the feedback that I've gotten from people that have had Reiki.
Thank you. And there are a couple other questions. I don't know if you can hang on for a couple minutes, but in the interest of time, I was going to move on to the next presenter. So if you have a couple minutes and you could answer those couple questions, that would be wonderful. And thank you so much for joining us. We always love having you.
You're so welcome. Thank you for having me.
Thank you.
Ladies, next up, we have a very special presenter. We have Sherimane Johnson. She's the vegan chef and owner of Night Owl. Night Owl is a vegan meal plan service. She also owns Naturally Sweet Desserts, a vegan bakery, and Plant Powered Shift, a coaching program that assists in the transition to a vegan lifestyle. Sherimane's experiences with the health benefits of a vegan diet and lifestyle encourage the creation of businesses that help people make healthy choices. She works with the local farms and high schools in the community to connect farms and the youth to inspire interest in veganism, food insecurity, and environmental stewardship. Sherimane holds a BS in behavioral science from Mercy College in New York City. She enjoys cooking, vegan food festivals, and old school hip hop. And the recipe that she is going to be making for us this evening is warm collard greens and butter bean salad. So let me see if I can pull her up. Melissa, are you able to spotlight? For some reason, it's not allowing me to.
I have her spotlighted, but her camera is not on. So
Okay.
We're just waiting for her camera to come on, Sherimane.
Okay.
And there she is.
I can't see you guys. Can you see me?
We can.
Man.
Okay. Hey, everybody. How are you? Good to be here tonight.
It's good to have you. Thanks for hopping on with us.
You're welcome. You're welcome. All right. So we are going to do a warm collard and butter bean salad. Now I'm hoping that I can turn my camera around so you guys can see. And I always have trouble with my phone, so my apologies. I'm trying to figure out how to turn the camera around so you can see the oven. Do you see the stove?
We see, I think we're looking at a ceiling.
Okay, no, that's not what I'm trying to do. Oh. Okay, I'm so sorry, and I know there's people here.
We did, we could see the stove before when at first when you said, I can't see you, we could see you and the stove. It was perfect.
Can you see the stove now?
No. I think you need to flip the camera around. So not the actual phone, but flip the camera so that we can see on the other side.
No.
Oh, there we go. Oh, I think we're
Yep.
Yep, I can see it.
All right. So what I'm doing is I'm gonna have to hold on to my phone while I cook because I don't know how to flip it around. So
No
just
problem.
be patient. All right, cool. So what we're going to do is the reason why I chose this recipe is because of the rosemary, which is great, has great antioxidants, and the garlic. So we're going to start off with, I use grapeseed oil. Gonna put a little bit of grapeseed oil in the pan. And we're going to start off rosemary first, sort of called blooming. What it does is it allows you to take advantage of the oil that are in the rosemary. I don't know if you guys, hopefully you can see. The oils that are in the rosemary, just let it cook just a little bit, just so you can smell. If you have rosemary with you, you can smell it. You turn it down just a little bit so it doesn't burn, but it helps to create the base for the recipe. When you're cooking with vegetables, one of the things a lot when you're cooking with vegetables is that there's a complaint that there's not enough flavor. So if you add aromatics like what I'm doing right now, which is the rosemary and carrots and onions, you turn it down. That helps build the base for the recipe and add additional flavor. We're going to saute these for a few minutes to the carrots and the onions. What we want is the onions to be slightly brown. We're going to turn it down, add a little bit of our broth. Now you could use water or you could use vegetable broth or homemade broth. So this is, I make my own broth. We don't have any waste since everything is vegetables. I'm been a vegan for a while, so we have very little waste. Use the strips, the trimmings and vegetables when you're eating, you're making salad or even a leftover to make broth.
Sherimane.
Go ahead. Go ahead, Melissa.
Oh, I was just going to say, Sherimane, it looked like your screen is frozen. It may be moving now. So we were only seeing a still shot, but now I think we are seeing the vegetables in the pot.
Okay, so what I did is I added the carrots and the onions and the rosemary, a little bit of grapeseed oil, and now that's just going to sweat. Can you still see it or is it frozen?
We can see it.
So it's going to sweat for a few minutes, and what it means by sweat is just basically allowing the condensation, the moisture that's inside the pot to help soften the vegetables.
Okay.
Now, I don't believe in cooking them all the way down. One of the things that happens is when we eat vegetables, and I know I'm in my late 50s, so back in the day, a lot of our vegetables were boiled to like death. Nobody wanted to eat them because they didn't have any flavor. So I like my vegetables to have a little bit of a bite to them. So I don't cook them all the way down to their mush. And also you want to have as much of the nutrients as possible, which is really, really important when you're healing your body, to have as many nutrients and eat as many whole foods as possible. So now we've got our onions, our carrots. Now we're going to add garlic. I like garlic. The recipe called for 1 clove, but I actually have 3. Garlic is awesome. It's great for you. It's an antioxidant. Helps to clean your inside your body, helps you to sweat. It's great for your eyes. It also is another food that is an anti-inflammatory. And all diseases are based on inflammation in the body. So as many foods as you can eat that can heal you from the inside out. Garlic is one of those things, and this recipe and a lot of recipes like this allow you to heal from the inside out. So rosemary helps to reduce inflammation, so does garlic. Greens have a lot of fiber. It helps you with energy, helps you with digestion. So there's, I used to be a type 2 diabetic. Anymore. I've been medicine free for almost 14 years, and and all of the work that I do with my food, and even Night Owl Vegan, is to let my customers know that they can heal their bodies with food. Depending on what you're eating, if you're eating a lot of salt, a lot of preservatives, of things in nature, they are not really going to heal your body, and they're not providing with the nutrients that you're looking for. So we put in the carrots, the onions, the garlic. Now I'm going to add my greens and a little bit of broth. So here's the collard greens. I chopped them up. The recipe calls for 5 to 10 minutes of the collard greens being covered in broth and cooked. 10 to 15. That's if you like it really soft. Again, this is a warm salad, so you don't really want your collard greens. You want them, in my opinion, to have a little bit of a bite. So what we're doing right now is just adding them to the pot, getting them to get a little bit of the coating of the bottom of the pan where we have the oil and the carrots and the garlic. We're just going to coat those, and then in a few minutes, we're going to add, hope you guys can still see. Sorry with this one-hand bandit cooking, but hopefully you can see the recipe. So we're covering up the greens, sauteing them just a few minutes just to get the cooking started, just to get them a little bit wilted. Gonna add a little bit of salt and pepper, but I usually like to add salt at the end, just to make sure it's not over salted. But black pepper, you can pretty much do liberally depending on how much you like black pepper. I like heat. Things like capsaicin helps you to sweat, and sweat is another way to get toxins out of your body. So if you add foods, the peppers, and if your stomach allows you to do so, if you can add some heat to your meals, it also helps you to heal from the inside out. Sweating is actually a pretty good thing to do. So now we're just going to add just a little bit of broth on top of our greens, about a half a cup, and then put the lid on. I hope you can hear that.
We can. This is
It sounds good and it smells good in here. So we're just going to cover that a bit and then add the lid so we can cook down a minute. And that will cook for about 5-ish minutes, 5 to 10 minutes. And then once that's done, we add the beans and the lemon and the other ingredients to round up the salad. So we've got a few minutes. If anybody has any questions while we're waiting for the collard greens to get a little bit soft.
Sherimane, there was a question was wondering if the grapeseed is better than olive oil.
So I like grapeseed oil because of the high heat capability. So olive oil, if you wanted to fry or saute something, olive oil might burn. Now you can look at me maybe now. No?
Almost.
Never mind.
There you are.
Olive oil might burn, but grapeseed oil does not burn. It gives you an opportunity to cook things at a higher temperature without burning. So you could use olive oil because the flavor is really great. But I've been using grapeseed oil for a while just because, just for that reason. And it also has some pretty good components that are really great for your body as well. And you can put it in your hair.
Great tip. Great tip. Also, you mentioned the rosemary and some of the other, seasonings that you could use. And, you mentioned before that it has medicinal purposes. Can you share a little bit more about that?
Sure. So some of the great things about rosemary is that it's great for your skin and your hair. It's also great for your brain, and it has anti-inflammatory components as well as detoxifying components, which helps to get rid of toxins in your body. And as I said, it's also really good for your skin and good for your hair. Just like even the lowly onion and garlic, they are still, and if you use them every day in your recipes, things like rosemary, like oregano is also a great antioxidant, something that you can use every day in your recipes. It helps to eliminate and lessen pain, because inflammation results in pain. So the more you can reduce inflammation from your body, then you can ease some of your pain by doing it with food. So I think our greens are wilted nicely. I don't know if you can see that, but it smells really, really good in here. So now we're going to add the butter beans. Now, butter beans are just a large lima bean. But the thing that I love about butter beans is that they have a very tender, buttery kind of mouthfeel. So they're really, really good in things like enchiladas because they're nice and soft, but they're filling. And it's also something that you can put together really quickly. This is a great soup, a great salad when you really don't feel like eating. This is better definitely the second day. Plus it has the greens, it has the beans and the greens will keep you full, and you don't have to eat a lot of it for it to keep you full. So we added the beans. Now we're going to finish up and add the rest of our rosemary. And we're going to add zest of lemon. And we're going to add white balsamic vinegar. So I like white balsamic vinegar because it's a little gentler than balsamic vinegar, in my opinion, when it comes to vegetables. And when I was a meat eater, I ate a lot of fish eater. I used balsamic vinegar a lot. The red wine goes really well with meat. But for vegetables, white wine is really what white balsamic vinegar is made out of. And it has a very different flavor. I actually even use it in my desserts. So if you guys have not tried white balsamic vinegar, I would suggest that you do. It's a little costly, but you're worth it. And it tastes, it is a distinctive flavor. So I think you'll like it. So we've added the balsamic vinegar, the lemon, and now we're gonna add crushed red pepper at the end. And now I'm gonna start with my salt and pepper because I've added all my ingredients. I'm getting ready to take a little bit of pepper. I use pink Himalayan salt. Not a requirement, however, it is good for the body. So everything that you do, every little thing accumulates. So you use the pink Himalayan salt, and then you use the rosemary, and then you use the greens, and then you use the garlic. And you know, this pot is like just as healthy as, more healthy than your medicine cabinet. So that's the way that's the way I try to encourage folks to think about cooking and eating. And that it's really nature's medicine cabinet. And a lot of the things that we need are here in a natural form that we can just cook every day and not have to take a pill and save money, and also elevate our bodies and our minds by eating as clean as we possibly can. So this is pretty much done. It just needs 5 minutes just to kind of sit. What I'm going to do is clean up a bit and then put it in a bowl so you can see what it looks like. At the end, we just add parsley. Now we add parsley at the end because you don't want to cook the parsley. You want to just have it warmed. If you put it in beforehand, it'll be cooked, and you'll be losing all of the really great healing benefits of the parsley. So let's get a bowl together, and we will.
Sherimane, it's interesting that you mentioned about overcooking veggies. I overheard one of our registered dietitians, Michelle, on one of her calls this week, and she said the same thing. Growing up, her family used to cook the heck out of the vegetables, which, you know, they'd come out like mush, but you're losing so much of the nourishment and that you can get out of those vegetables.
Absolutely. And I think that, you know, it's just lack of knowledge and probably appreciation of just, you know, how wonderful the vegetables are, especially since we've become, or we're moving away from being a more meat and cheese heavy diet. The lowly vegetable really didn't get the honor that it was supposed to get. And I'm happy to see that now it's starting to get what it's supposed to get. So that is, I don't know if you guys can see.
Oh, that looks so good.
We've got our parsley on top. And if you wanted to, there's a little bit of lemon juice that you could put on top to add. I actually added a little bit more balsamic, but that's it. So it is a warm collard and butter bean salad enhanced by rosemary, which is great for your brain and your body, and garlic and black pepper and red pepper flakes.
It looks delicious.
Thank you, everybody.
We had a question actually about the pot you were using.
Now, how do I?
Could you share if your pot is stainless steel or aluminum, just out of curiosity?
This is a stainless steel pot.
Okay.
Let me make sure. Yes, stainless steel.
Awesome. Thank you.
You're welcome. You're welcome.
Great, and I did include the recipe in the email that I sent to everyone this morning. And I just tried to attach it, and for some reason it's not attaching in the chat room. But if you did not, for whatever reason, receive that email or that recipe, you can certainly reach out to me and I can send that back out to you. Sherimane, that looks wonderful, and I have not had dinner yet, so that might be something I can whip together quickly.
Sherimane, are there any other,
Awesome.
any different greens that you could put in there, or any different beans that you could swap in?
Yes, and I wish I could figure out how to turn this around so you can see me. Yes, you can use any bean that you want, and any green. This would actually be really great with Swiss chard, especially because I love how Swiss chard has the red and different color stems. Those stems are so good for you, good for your body. So you can use any kind of green. Kale was really popular these days. Any kind, you could probably do a black or a kidney. It's just that the lima bean is a little softer in regards to it being a salad.
Okay.
But this can be customized to whatever you desire.
For anyone who's in our local wellness program, I think you got kale in your CSA box if you are getting your CSA share. So you could definitely try this and throw in some of your fresh kale you just got from Lancaster Farm Fresh.
That's absolutely right. Absolutely right. And if they have any kind of beans in the box, oh, here we go. Can you see me?
There you are. Yes.
I figured it out at the end. If you have any beans in your box, you can use any kind of bean. It's a very customizable recipe. You can add whatever you like. The most important thing about it is to start off with some sort of aromatic, oregano, rosemary, something even sage or bay, and then add your onions and carrots as the base of your recipe, then add the rest of your ingredients. But you can swap out any bean and any green that you would like.
That's good to know. And I love hearing you talk about the benefits of things such as rosemary, and just follows along with what we talk about with nutrition. Both Erin and Michelle talk about the healing properties of our foods. And I mentioned the Cancer Fighting Kitchen Cookbook in the chat that Erin references during our wellness days. And the first 40 pages are all those things and the benefits of all of our spices and our seasonings and our fruits and our vegetables and the importance of them. So I'm glad that you mentioned that as well. It just reinforces that for everybody.
Absolutely. I 100%, as I'm a testimony of that. And I just think that we're so quick to throw things together, and it's easy to eat processed food sometimes because it's quick and we don't necessarily feel like eating, but sometimes the extra salt and things in the packaging, the frozen foods and the things that are easier for us to eat actually are not really great for our bodies. So our spice cabinet is turmeric and cumin and all kinds of things and I would recommend, even though this is not in the recipe, but if no one is taking turmeric and black pepper every day, I would recommend that you do that. It helps to decrease inflammation. It could be something that you add to your oatmeal every day. It could be a little tonic that you drink, but you will find that in a couple of months, if you're consuming turmeric and black pepper, they need to go together every day. Your body will feel better and you'll be like, oh, I don't feel as achy. It won't be an immediate thing, but over a period of time, it will begin to decrease the inflammation in your body, which ultimately decreases your pain. So I would recommend anybody that's listening to do that if you're not already, and not the turmeric in the little capsules, the actual powder with a little bit of black pepper in your oatmeal or in your coffee every day. It's definitely recommended.
Thank you for sharing that. I had been in the habit of putting it in my coffee and I fell out of it. So that's a good reminder for myself. Thank you. And Sherimane, can you share, you're local to Philadelphia, is that correct?
Actually, I used to be in Philadelphia. I live in Maryland now.
Okay. So if any of our women here are from Maryland, feel free to go visit.
Yes.
Oh, I see some hands waving. Betty, are you in Maryland? Yes, okay. Betty's gonna come see you.
Where in Maryland, Sherimane, please?
I'm sorry, I didn't hear you. Say that again?
Where in Maryland?
So I'm in Greenbelt and I'm starting a 9-hour vegan weekly meal service again here, serving 10 miles outside of Greenbelt. So that's into the DMV, up into the upper parts of Maryland and into Virginia. We'll be starting our meal service plan very soon.
Okay.
Where are you located in Maryland?
Columbia.
Oh, so you're close to me.
Yeah. Mhm.
And I'm even closer. I'm in Laurel.
Oh, wow.
Oh, well, I could still you could be right here. Yeah, my kitchen is in Hyattsville. My
Can I-
kitchen's in Hyattsville, and I'm
Okay.
putting out some information really soon on when we deliver as far as Annapolis.
Oh, wow. I have a question concerning olive oil and the fact that it cannot like stand, you cannot heat it. But when you want to use olive oil to cook, can you just put it in the pot and put your onion in it and let it heat as the onion is cooking? Is that the same thing, or you're still burning it?
It's the same thing, but if you turn your olive oil up really high, it'll start to smoke. So as long as you have your olive oil at medium high or medium low, and you slowly cook your onions and you make sure, because once it smokes, it puts a burnt taste in your food. Even if your onion isn't burnt, that smoky taste will mess up your recipe. So as long as you're keeping your olive oil to a point where it doesn't smoke, then that's fine.
All right. Thank you.
And there's benefits in olive oil. Olive oil is a great oil. It tastes really great. It just, it doesn't have a high smoke point. So depending on what you're cooking, it might mess up your recipe. But olive oil and slow cooking your onions is perfectly fine.
Okay.
Well, Sherimane, thank you so much for joining us and sharing that recipe with us. It was beautiful. I can't wait to make it. I'm sure some of these ladies on here are going to make it. Thank you for spending your evening with us and hopping on. And we hope that we will have you on for another event soon.
Thank you so much for having me. It was awesome being here with all these wonderful people. And again, thank you for inviting me. I appreciate it.
Oh, thank you. All right, ladies.
You.
So we are coming up to the end of our special speaker series this evening. I wanted to run through a couple reminders with you really quickly again of some of our upcoming events that we have. So tomorrow we have our Ask the Experts about healthy beauty. If you don't have social media, if you're not on Facebook, that event will be available on our website within 24 hours, I'm being told. So you can go probably to her library that we put that link in the chat to find that Ask the Experts. Probably by Friday, it will be up there for you. If you are on social media, please feel free to join us tomorrow at 1 p.m. Eastern. And then on March 2nd at 5 p.m. Eastern on Zoom, we have our virtual hangout with Priscilla Fitzpatrick with Stronger Through Cancer. For those of you who are in our wellness program, you can do 3 squares for a 6-month virtual membership. But then also, if you don't have your passport with you anymore, if you've already gone through the program, you can still participate in Stronger Through Cancer. You can do a 2-week trial if you wanted to. It's free. Try and test it out, see if you like it. And then if you do, you can sign up for a 6-month membership with Priscilla. And then lastly, we have our next speaker series on March 3rd at 6 p.m. Eastern. This is going to feature a program from Revital, and that's all about that chemo brain. So it's talking about how to manage and improve that cognitive decline that often comes with chemotherapy. So keep that in mind for our future events. As always, our wellness team is here for you, even if you're no longer in our program. We love hearing from our women. So please feel free to reach out to us at any time with any questions that you have. If you just want to check in with us, if you want to give us feedback, we'd love to hear from you. And lastly, I want to remind you all that this wonderful education series was brought to you by our 2022 education sponsors. So we want to give special thanks to our presenting sponsor, Merck, as well as our supporting sponsor, Exact Sciences, that just help us to bring these events to those that we serve. So thank you again for taking time out of your afternoon or evening and joining us for this special event. I want to give a lot of credit to my colleague Melissa, who this was her brainchild, this was her idea. So I thank her for coming up with the idea and the creative background, and for putting the agenda together, and for all of our presenters as well for taking time out of their day and sharing it with us. Thank you, everybody.
Thank you for joining us. We really appreciate having you, and we hope you enjoyed every moment of it. If you have any questions, we are certainly still here. You can contact us. Anything you need, we will try to provide for you. Thank you. And Sherimane, thank you so much. Rae, thank you so much. Dr. Whittaker had to jump off, and Christy had to jump off as well, but you guys were excellent. We appreciate you. We love your support. Thank you so very much.
Thank you, everybody. Good night.
Good night.
Thank you, everybody. Thank you.
Good night, everybody.
Good night.
Thank you, Nina.
Nobody's doing that. He's indicated.